talk to Dr. Charles Levinson, GP, Chief Executive of Dr. Call, because guess what? There's more strikes coming. Junior doctors will strike for 3 days in June, and they're now threatening a summer of misery, for heaven's sake. Dr. Charles, very good afternoon to you.
Good afternoon.
Thanks for joining us. When is this all going to end? You know, it seems to me that there's some people in the medical business who would rather quite like to go on strike continually because it suits their purpose. But surely doctors shouldn't be striking, should they?
It's a real shame, isn't it? I think there's a huge amount of dissatisfaction in the profession, and that's really the problem. Yeah. I think it's really, I mean, the strike is for more money, but I don't think that's really the underlying issue. And I think it's that doctors are increasingly asked to practice in a sort of algorithmic way. So they have to follow a formula instead of thinking for themselves what would help. And that's just not satisfying. And it doesn't use their skills. And there aren't enough of them anyway. And so what they need to do is to start removing the more simple things from the GP's job role. Like
what would you say?
So what they can do for the GPs is an awful lot of things that people present with. The GP doesn't have the choice of how to treat it, so he's not using his skills at all. Right. So if someone comes, if Mike, if you turn up with a cough, in years gone past, I would have said, as a doctor, I would have said, right, you know, Mike is a busy chap and he's got to go on the radio on his show tomorrow, and I'm going to give you a slightly stronger antibiotic. Mike, they're not allowed to now. They have to give the first line antibiotic, right. And that's fine if that
works. Well, sometimes in the first instance they'll say something like, "Well, why don't you see how you are in about 5 days, and then if you're still ill, then I'll give you some antibiotics."
Well, yeah.
That's what they do usually.
But again, if that's going to be passed down from on high, you don't need the GP in the loop at all, right. And that is why it's so dissatisfying for them. And if you can, and that can, I know they've tried handing this out to pharmacists and not, I think, with some hiccups. But it can also be handed out to if it's going to be an algorithm. If you're going to tell the GP that he doesn't have a choice, this is what he does. You can give him. You can ask the patient some questions on their app. How long have you been coughing, and are you coughing up sputum? And if you are, you can send an electronic prescription to the phone, and that's been transformative. The electronic prescribing, it used to have this challenge of how you get the prescription to the patient. Right. Now you can send it straight to their phone, and they can turn up at a pharmacy and collect it.
Yes, and Rishi Sunak just the other week was saying that they wanted to give more sort of power to the pharmacy, if you like, to do more things that the doctors are currently doing. But of course, the people in pharmacies have said, well, that's all very well, but where do we get the funding for that, and how do we have more people in pharmacies in order to dispense more medicine?
Well, they have a history of announcing that someone else is going to do work for them, and it needs to be, they need to communicate properly in advance. If they wanted the pharmacists to do it, they would need to give them lots of warning to recruit and so on. What I think, I think that's the simple reason that technology has to be used. That because you don't have to recruit apps. You know, you can people can operate themselves with their phones.
I mean, do you think there's room for some form of kind of almost self-medication? I don't mean by that people should be operating on themselves or anything like that, or diagnosing themselves. But I mean, if you are, say, for example, suffering from some kind of ongoing problem, that you have a repeat prescription that you can maybe email the doctor and get them to just send out a repeat prescription, and that might save a bit of time as well.
You can, well, repeat prescriptions should already be available like that, but new prescribing also can be available like that in certain circumstances. And I mean, some people can't use apps because they're elderly, they don't have smartphones and so on. And but if you can offer those who want to, if you can offer them rapid access through their phone app, then you can take the pressure off.
Right. But, I mean, to go back to the junior doctor strike, and if they continue with this, you know, that's going to be another impediment to any reduction in the size of the waiting list, isn't it?
Yeah, it is. It is going to. Yes, it is. It is. It just adds to the delays.
Yeah.
But it's again, there are other things that. So this 8 a.m. queue to see a doctor is not the fault of the doctor strikes, and that is a thing that it would be incredibly easy to fix. You know, everybody in the private sector has online booking.
Yes.
And why in this, you know, in 2023, do you have to sit on the phone for hours to try and get an appointment?
Well, again, you know, it was about 2 weeks ago, I think, where 240 million quid's about to be spent on a new phone system. And you think, well, if it's that easy, why didn't you do that before? You know, you're now going to get a phone system which will operate like every other phone system, as opposed to the one that the NHS has been using for years, which doesn't work, which makes you wait online or makes you just keep getting a busy signal instead of knowing which number you are in the queue.
Yeah, and I think technology is so transformative. Just as an example, at Doctor Call, which is a bit more difficult, we're sending out doctors on home visits, and we used to receive a phone call, and people would have two questions: how much does it cost, and when can you get here?
Yeah.
And we could tell them what it costs, but to tell them when he'd get there, we'd have to look at the map, work out where we thought they all were, ring the one who we thought could get there soonest. He wouldn't pick his phone up because he'd be with a patient or he'd be driving.
Right.
And eventually get back to the patient and say he can get there in whenever. Now, the patient can log in and just see it'll be 47 minutes, or they can ring up and we can log in and see that, and it's instant. And that's just been a sort of simple example of how a bit of technology can transform what you do. And it is really not complicated for the NHS to be a bit more imaginative.
No, quite. Final point for you. Apparently, the number of dentists now doing NHS work has fallen to a new low, lowest it's been for about 10 years. Are you surprised by that?
No, I think dentistry has sort of exited the NHS effectively some time ago, hasn't it? I mean, I think that
I mean, people have been paying for dentistry for a long time, haven't they?
Yeah. No, and so I think that's inevitable, and I think that is the way that if they don't get on and sort out GP bookings, that's the way that that's going to go too.
Yeah, which has been a very sad day, unfortunately. Good to talk to you, Dr. Charles Levinson, GP and Chief Executive of Dr. Call, with the bad news, I'm afraid, that there's going to be yet another junior doctor strike. They just seem intent on doing it. They don't seem to want to stop doing it. They don't seem to want to settle the dispute. I think they just want to keep going on strike because it's their way of sticking two fingers up to the government, which they hate. Bizarre.